Welcome, everyone. My name is Alex Huffman. I'm the Assistant Director of Support Services here at the Cancer Center, and I've been your moderator for our monthly Lunch and Learn series since we started this a few months ago. Thank you so much for being here. We hope some of you are returning and that you've joined us before. And if you're new to this series, welcome, welcome. You've come at such a wonderful time to get great information today. We really want to ensure that you guys know that this time is for you. We do have a couple of housekeeping guidelines to give you at the beginning. The first is that this session is being recorded. And again, that is for you so that you will get a copy of this sometime next week sent to you via email so that you can reference it as you might need. We also want you to know too that as much as we want this session to be relevant for you today, our wonderful guest speakers are not going to be able to provide direct mental health counseling for specific needs. So if that does come up for you, we hope we can direct you back to your clinic here to determine if a referral might be necessary. But please put questions in the chat. We want to provide as much information as we can today, and we will get to those questions after the presentation. So I'm going to do a quick introduction of each of our speakers, and then we're going to turn it over directly to them. Our first speaker is Ashley Nedebalil. Ashley is an assistant professor in the Department of Psychiatry at UT Southwestern Medical Center. She joined UT Southwestern's faculty in 2022. Dr. Nedebalil is currently providing outpatient psychotherapy services within the psycho-oncology clinic at Simmons Comprehensive Cancer Center here at the Dallas site. She also provides supervision and teaching to doctoral trainees from the UT Southwestern Clinical Psychology doctoral program. Dr. Nedebalil is also passionate about health psychology research. Thank you for being here, Dr. Nedebalil. And you are joined by Akini Wosisi. Akini is a second-year clinical psychology doctoral student at UT Southwestern Medical Center. Since May of 2023, she has received clinical training across 3 outpatient cancer clinics within the Dallas-Fort Worth Metroplex. Under the direct supervision of licensed psychologists, Akene provides individual and group psychotherapy to help adults cope with cancer-related distress. She's an aspiring clinical health psychologist and hopes to continue advancing quality mental health for communities in need. Ladies, thank you so much for being here, and I'm going to turn it over to you for the topic of the fear of recurrence. Thank you.
Thank you, Alex. Thank you, everyone, for joining us here today. It's so nice I know I can't really see everyone, but it's so nice that you're here. Like Alex said, I'm an assistant professor here at the UT Southwestern Cancer Center, and I'm joined by one of our lovely doctoral trainees, Akene, and we'll be co-presenting and talking a little bit about the fear of cancer recurrence, which is a topic that is pretty applicable across the board, regardless of what cancer diagnosis you have or where you're at in the treatment process, whether you actively have the diagnosis or are in survivorship. This is something that can come up for you. So we'll talk a little bit more briefly about, I'm going to move to the next slide here. Okay, so this is our agenda for our session today. So we're going to do some introductions around what is fear of cancer recurrence, right? Then we'll kind of help you understand the impact and the role that it plays in your mental health functioning. Then we're going to talk about some coping strategies and techniques that you can use to better manage those symptoms that you may be experiencing. And then we'll be wrapping up with some additional resources for you all and wrap up in questions.
Yes, so on the note of fear of cancer recurrence, these are a few of among many fears tied to the fear of cancer coming back or progressing, which is known as fear of recurrence. These thoughts may be applicable and experienced by people in active treatment, meaning they have an active diagnosis and receiving treatment for their cancer, as well as those in survivorship, meaning there's no evidence of disease, but they're trying to focus on readjusting to life. So you may relate to some of these thoughts. I'll select a few from the screen. Common thoughts may be, when will the next shoe drop? What if I'm never going to be able to work again? I won't be able to cope with this diagnosis. What if the treatment doesn't work? We'll sit on this slide for a few more moments, and you may see some that you could relate to. We would like to emphasize that feeling anxious is very normal and a common experience among patients living with cancer. The research literature tells us that around 10 to 19% of adults diagnosed with cancer may experience anxiety during or after cancer treatment. Cancer-related anxiety may show up as a response to the uncertainty around your diagnosis and the changes that follow from common cancer treatments such as chemotherapy, radiation, and immunotherapy. There are changes that may experience may be physical, but also may show up in other areas as well, such as how you're able to do your daily activities and in your social interactions. For patients who have completed their cancer treatments, fear of cancer recurrence is very common, even after they are done, and they may experience it several years after. Again, fear of cancer recurrence and anxiety is very normal, with the literature telling us that 22 to 87% experience moderate to high levels of fear of cancer recurrence. So, first off, what is fear of cancer recurrence? Fear of cancer recurrence, or FCR, is the fear, worry, or concern about cancer returning or progressing. And therefore, it's an experience that can show up for people regardless of where you are in your cancer journey, whether you got newly diagnosed or if you're a survivor. While FCR can be very distressing, the research tells us that low levels of FCR can actually be helpful, especially for those who are able to safely express their fears and feelings to someone that is willing and open to listen. This can actually reduce anxiety over time because you're not holding it to yourself. However, high levels of FCR can be harmful, especially when they're very overwhelming. Clinical levels of FCR can be defined as frequent, persistent, intrusive thoughts, wanting excessive reassurance or seeking body checking, automatically interpreting body sensations as a sign of cancer recurrence, and many more triggers. As you can imagine, experiencing this can lead to major difficulty in completing different things in your life, such as your ability to do your work effectively, go to school, complete tasks at home, or get along with other people. As a result of experiencing all of this, high levels of FCR can lead to prolonged anxiety, depressed mood, a lower quality of life, and as mentioned before, poorer functioning in what you have to do in your day-to-day.
Okay, so now that we've talked a little bit about what is fear of cancer recurrence and the different ways that it can really show up, like Kenny said, it can really show up as anxiety, it can show up as depression, insomnia, irritability, right? These are some very common and common manifestations of fear of cancer recurrence. Now that we've kind of talked about what it is, we're just going to talk a little bit about a model here for you to understand how this fear of cancer recurrence can play out in your day-to-day and be connected to different facets of your mental health functioning. So this is what we call a cognitive behavioral therapy model, or a CBT model. I'm not sure how many of you've heard of CBT before, but it tends to be the gold standard of treatment for treating various mental health conditions, including depression, anxiety, insomnia, etc. So we're just using this model to help you better understand how fear of cancer recurrence comes up and how it's going to affect different facets of your functioning. Okay, so before we kind of go into the example that's highlighted here in the slide, I'm just going to walk you through this model so that you understand the relationships. Okay, so when we're looking at this model, we start with the situation, right? So something happens, whether that's something that happens inside our body or something that happens around us, that tends to trigger or set off fear of cancer recurrence or anxieties. And this, like Kenny said, there's lots of different triggers for this, but internal triggers would be, noticing a new symptom or a new sensation that wasn't there before. External triggers could be maybe seeing an ad on TV about cancer, right? That could be something that sets off, a fear of cancer recurrence. So triggers can be internal or external, but that all kind of falls under the triggering situation box. Something happens, and then that directly leads to what we call automatic thoughts. So the whole idea behind this model is that it's not the situation, but rather the way that we interpret the situation that affects our mental health and the way that we feel and how it influences our behaviors, right? So all of us can have different interpretations of the same situation, right? So these automatic thoughts, they're called automatic because they pop out pretty quickly. Maybe you don't even notice it, very automatically, right? And it's very hard to catch them. But we all have automatic thoughts every day at any given moment. You're probably having an automatic thought right now as we're walking you through these slides, right? So automatic thoughts are not necessarily problematic, but when you're struggling with anxiety or depression or clinical levels of FCR, you might be having negative automatic thoughts. So negative automatic thoughts are ones that tend to be unhelpful. Generally, they might be ones that kind of assume the worst of a situation, or you try to predict the future, right? Those generally tend to be those unhelpful, negative automatic thoughts. So situation happens and you interpret the situation via this thought, right? A thought is a way that you interpret something that's happening around you. And then once you have that thought, it's actually connected to three other things here. It's connected to your feelings, which is your emotional state. So feelings are like, are you happy? Are you sad? Are you anxious? Are you disappointed? Are you guilty? Right? Those are your emotions or feelings. These thoughts are also connected to your body sensations. So these are physiological experiences that you may be having. So things that are out of your control, they tend to be involuntary. So like an increase in heart rate or sweating or shaking, right? These are things that automatically happen in your body when you're responding to something. These thoughts are also connected to your behaviors, right? So as one would expect, the way that you think about a situation or interpret it definitely plays a role in the way that you choose to respond to it, what you do or what you choose not to do, right? So you have a situation happen, then that leads to an automatic thought, right? And the thought ends up influencing all of these other areas in your functioning. And if you look closer at the diagram, you can see that there's arrows going all different ways between these four boxes, and they go in both directions. So what that tells us is that not only do thoughts affect behaviors, for example, but behaviors can also affect thoughts. Or body sensations can affect feelings, but feelings can also affect body sensations. So as you can see, they all kind of feed into one another. And this can sometimes leave you in a vicious cycle of feeling anxious or depressed, especially if you're noticing, fear of cancer recurrence coming back up for you. So now that we've kind of talked about what this model is, let's look at this specific example for a second. I don't know how many of you can really see or read the text, but I'm just going to read it out to you, right? So let's say the trigger or the situation is you wake up one morning and you notice pain or pressure in your chest region, right? Or your underarm, right? So that happens. That's the situation. And then that's connected, that ends up eliciting a thought for you. Oh, this could be the return of cancer, right? You might also have a thought, I'm always in pain. Or if this doesn't get any better, I can't exercise, I can't go to work, right? Those are all examples of thoughts that you may have. Now, for the purposes of our talk today, we're going to be focusing on this could be the return of cancer. That's the fear of the cancer recurrence. So let's say you have that thought, okay, this is the cancer that's coming back, right? That's going to affect the way that you choose to behave in this situation, right? If you end up having a thought, okay, this is the cancer coming back, you might choose to cancel your plans for the rest of the day, maybe just stay in bed, right? Because you're feeling disappointed or scared or dejected, right? By noticing the symptom. You might also choose to call your doctor or your nurse as a way of trying to get more information and maybe get some reassurance or, trying to alleviate your anxiety in that moment. So those are behaviors that you're doing, things that you're actively doing. And it's tied to this thought that you have, okay, the cancer is coming back, right? Now, these behaviors, staying in bed, canceling your plans, calling your doctor or nurse, those could actually end up worsening some of your body sensations, right? you might notice increased tension in your body, right? Because you're thinking that this is the cancer and you're staying in bed, you're not moving around. So you're going to collect more tension in your body. Maybe it comes out in the form of a headache, right? Or a migraine. Or maybe the pain that you noticed in your chest or underarm has actually gotten worse now, right? Because you're choosing not to move around or do anything about it, and you're having this very negative thought. And those body sensations are, of course, going to contribute to your emotional state of mind. So that might feed into your anxiety, feed into your fear, make you feel more sad or angry. And those feelings in turn, once again, feed into those thoughts that you're having. Okay, this is the cancer that's coming back, right? And all four of these boxes, like I said, they feed into one another. So feelings can also affect the behaviors. Staying in bed can make you feel sad, but feeling sad can also make you stay in bed, for example. So as you can see, this kind of leaves you in like a vicious cycle, right? And in our later slides, we're actually going to be talking about some ways for you to address this, whether that's in therapy or even outside of therapy. We'll be referencing back to this slide a few times during our presentation. But I hope this is clear. And if you have any questions about this, we're more than happy to clarify this at the end of the presentation. So now I'm just going to pass it over to Akene for our next portion. We're going to talk about coping.
So as Dr. Nedovello mentioned, how do we cope when our automatic thoughts become very overwhelming and the consequent fear and anxiety and sadness become too hard to bear? So we have a bunch of recommendations listed on this slide in no particular order, and I'll walk through them right now. So the first is speaking to your medical provider about the facts about your case. So a lot of times people may fall trap to quote unquote Dr. Google, but Dr. Google contains a lot of extra information that doesn't encompass everything that relates to that's just you. So we recommend not only talking to your medical provider, but also asking them to repeat, clarify, or provide any additional resources to help you leave your visits with a better understanding of your diagnosis. We understand this especially may be hard at times, especially for those who have difficulty speaking up in a medical setting. But to help with that, we encourage you to write questions in between your visits to come prepared and ask if you have anything on your mind. This can help regulate and calm you down so that you feel you have more control over the situation. If you're in need of more emotional support that's more consistent, we also recommend seeking psychotherapy services. So Dr. Nedovello and I, as mentioned, we provide psychotherapy services for individuals living with cancer and who need additional support coping with the adjustment. But you can see any provider. If you want to see someone focused on cancer, you will learn specific skills to address the anxiety associated with cancer, such as fear of recurrence. You'll learn a lot of different techniques and coping skills, such as the ones listed on this slide. You'll learn relaxation techniques, some of which we'll walk you all through today. And this will really target calming you down and targeting those body sensations that was mentioned in the previous slide. A lot of times we don't have control over when our heart races fast or we have trouble breathing, but these relaxation techniques will really help ground you and center yourself in the present moment to bring you back to center. Other skills that you would learn would include restructuring or changing your thoughts. With a particular model such as cognitive behavioral therapy, you'll take a closer look at your thoughts, and upon doing so, you may be able to identify whether these thoughts are helpful or not helpful to you. And a third one, which might sound a little odd upon first reading it, is scheduling worry time. So a lot of what makes anxiety so overwhelming is that we feel like it's out of our control, and especially if it's happening multiple times a day every week. The literature recommends scheduling your worry time to have more control over your anxiety and worry. They typically recommend scheduling your worry for no longer than 30 minutes, like 10 to 30 minutes, schedule it out and let yourself worry. Once that 10 to 30 minutes is up, try your very best to redirect your attention on other things for the day. This is found to be helpful to manage your anxiety. If you're unable or don't need to seek psychotherapy services at this time, we also recommend using your support system if you have trusted people. As previously mentioned, it can be very helpful to express how you're feeling or how you're coping to those who will offer a listening ear. It may be hard, especially if you're uncomfortable asking for help, but asking people you trust for things as simple as, or not as simple as, but as a task such as helping you cook a meal or even helping join you to your medical appointments. Those acts of service can go a long way, and that's something that your support system would hopefully be more than happy to help you with. If you are in need of seeking support and community from people who identify with your cancer experience, so they either have a similar diagnosis or are also going through treatment at the same time, UT Southwestern specifically offers many support groups and classes for you to foster community and relate to people who may relate more closely to what you're going through that maybe your support system might not be able to relate to. And finally, today for the another part of our presentation today, we'll teach you concrete skills to help manage your anxiety and manage your anxiety and fears as they come up using effective coping strategies. The first one will be progressive muscle relaxation, and the second one will be diaphragmatic breathing. So I'll offer a brief introduction on what progressive muscle relaxation, or PMR, is, and then we'll get into the practice together. So PMR is a relaxation technique developed in the 1920s by Dr. Edmund Jacobson. And the way PMR works is walking you through actively contracting your muscles from head to toe or toe to head and create tension, and progressively tense and relax those muscle groups. This is especially helpful, especially when your symptoms, your body sensations become very hard to bear or cope with. Will help you focus and ground yourself. And whenever we are anxious or carry a lot of fear, we may not notice how much tension we're carrying in our bodies. So this practice will really bring that to the surface and allow you to release all that tension you're holding up in your body. All right, so we're going to try a brief PMR exercise together. If you are able, please get into a comfortable position. Feel free to close your eyes, and if not, keep your eyes on a fixed spot and just follow along as I direct you with this exercise. Please note that if any part of what I instruct you to do causes you any sort of pain, please feel free to stop that movement, stop that stretch, and refrain from stretching that muscle group. All right, let's begin. Begin by taking a deep breath and notice the feeling of air filling your lungs. Hold your breath for a few seconds. Release your breath slowly and let the tension leave your body. Take in another deep breath and hold it. And slowly release the air. Now, move your attention to your feet. Begin to tense your feet by curling your toes and the arch of your foot. Hold that tension and notice what it feels like. Now, release the tension in your foot and allow your toes to get back to its normal position. Notice this new feeling of relaxation as you do so. Now, moving up from our feet, bring your focus to your lower leg. If you are able, Tense the muscles in your calves. Hold them tightly and pay attention to that feeling of tension. Now, release that tension from your lower legs. Sit with the feeling of relaxation that comes with it. And remember to continue taking deep breaths. Now, moving up to the muscles of our upper leg and pelvis. You can tense these muscles by tightly squeezing your thighs together. It may help to visualize a penny in between your knees, and you don't want that penny to drop on the floor. Make sure to feel that tension without going to the point of pain or strain. Now release. Feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking your stomach in. Squeeze and hold that tension for as long as you can. Release that tension and allow your body to go limp. Let yourself notice and sit with that feeling of relaxation. And as always, continue to take deep breaths, breathing in slowly and noticing the air fill your lungs. And exhale, feeling your breath leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can, but not so much so that you're feeling pain. Release the tension from your back by bringing your shoulders back to their normal position. As you do so, feel the tension slowly leaving your body. Notice how differently your body feels when you allow it to relax. Tense your arms all the way up from your hands to your shoulders. You can do so by making a fist. And squeeze all the way up your arm. Hold it. And release. You should feel that relaxation wave from your arms to your shoulders. Notice as relaxation flows through fingers and your hands, and how your arms may feel at ease. Now we'll move up to the neck and to your head. You can tense your face by smiling really wide and feeling that tension in your cheeks. Hold that tension. And release. Take one deep breath in. And breathe out. Begin to wake your body up by slowly moving your muscles from head to toe. And whenever you're ready, feel free to join us back for the presentation.
Okay, so Akene just led us through a wonderful progressive muscle relaxation exercise. And like she mentioned, that's one of many relaxation tools and techniques that you could use and may learn as a way of kind of coping with any anxiety or discomfort or stress that you may be noticing when you think about, cancer coming back. Now, like we talked about, these are strategies that are targeting the body sensation specifically. So I'm actually going to be walking you through one more very brief exercise. And this actually is something that's built into the PMR to some extent. It's a diaphragmatic breathing. You may have heard of it before. It's called deep breathing or belly breathing. So essentially, the diaphragmatic breathing is an exercise that uses the contraction of the diaphragm muscle. So we'll talk about where the diaphragm muscle is located if you don't know. But you contract the diaphragm muscle to move air downward into your body when you inhale. So that increases the diaphragm's length and increases breathing efficiency. And it also facilitates better exhalation, right? So if you look at this little diagram that we have here, or this little GIF that I've added, you can see that the diaphragm is the part, it starts where the green is. So it's right beneath your ribs, right? The top of your belly, so to speak, right? So that's where you want to be inhaling and exhaling from. Right now, you and I, we're all probably taking some pretty shallow breaths, which is fine in our day-to-day lives. We don't need to be taking deep breaths all the time. But when we're feeling anxious or really stressed out, right, our fight or flight system gets turned on, right? And that's when we're getting ready to ward off a potential threat, right? That may not be helpful, right, when we're dealing with a situation like this, right? So the diaphragmatic breathing exercise is a way to kind of turn off the fight or flight system and induce a sense of relaxation into your body. Now, this is an exercise that's actually been shown in research to be effective in reducing discomfort associated with lots of medical conditions, including asthma, and also anxiety, amongst others. So we're just going to be walking you through a very brief exercise here. And this is something that you can do at any point in time. You can do it when you're sitting up or lying down. Just find yourself in a comfortable position, whatever that may be, and feel free to follow along if you would like. And like Akene said before, you can close your eyes or leave it open on a fixed spot. And I'd like for you to take one hand and place it on your chest, okay? This is where your breaths come from if you're taking shallow breaths. So you notice your chest moving up and down, right? Now I'd like for you to take another hand and place that on your diaphragm, right? So right underneath your rib cage, okay? And that's where your breathing should come from if you're doing the diaphragmatic breathing. You want your belly to be the one that's going to be moving more. And you want this hand on your chest to stay as still as possible. Okay, so your inhales and exhales are going to come from the diaphragm. Okay, and when we ask you to inhale, inhale through your nose and give it a few seconds. I'm going to ask you to give it maybe 4 seconds. Okay, and then when you exhale, do it through your mouth. It's okay to let yourself like make a sound as you exhale the air out. And you're also going to give that a few seconds. If for some reason the amount of time that I'm using for this particular exercise is too long, or you can't, inhale and exhale that slowly, feel free to change it up slightly based on what feels comfortable for you. But we just want to ensure that the breathing isn't too rapid and shallow. So try to give it a few seconds if you can. Okay. So you can close your eyes or leave them open and get comfortable. And when you're ready, let's take that first inhale. Inhale 2, 3, 4, and exhale through the mouth. 2, 3, 4, 5, 6. Inhale 2, 3, 4, and exhale through the mouth. 2, 3, 4, 5, 6. Inhale, 2, 3, 4. And exhale, 2, 3, 4, 5, 6. Keep that pattern of breathing and breathe deeply, filling the belly with air and then slowly exhaling all of that air out. Once you've fallen into a pattern, imagine that your belly is a balloon and that it's being filled with air as you inhale slowly and then deflates as you exhale slowly. Keep breathing through your nose and out through your mouth. Try to notice the sensations of your belly moving up and down. Your chest should remain as still as possible. Notice feelings of relaxation as they may come over you. Maybe you notice that your shoulders have become relaxed, your arms, your jaws. And allow yourself to fall into the rhythm of the inhale and exhale as it comes from your diaphragm. Great. That was a very brief demonstration of this exercise, and you can keep doing this for 5-10 minutes, for as long as you would like. But I would recommend, at least 5 minutes if you can.
Thank you, Dr. Nadavella, for that wonderful practice. So we would like to conclude our presentation today by just reviewing some additional helpful information on how to manage your physical health. You may or may not already be aware of some of these tips and information from hearing them from your oncologist and other medical providers, but there are general guidelines listed on the American Cancer Society website on how you can continue to take better care of yourself. This ties to helping with fear of recurrence because you have some control over some of these items here, and that can also help alleviate that anxiety. So some of those things include maintaining a healthy weight and healthy diet, and being physically active. We do also want to emphasize that especially with certain cancer treatments, such as chemotherapy and radiation, people typically feel very low energy afterwards, and it may be harder to complete activities in the way that you used to. So just being sure to be as mindful as you can to not overexert yourself. The American Cancer Society also recommends cutting out certain substances such as alcohol intake and smoking tobacco. And as always, we want to encourage keeping up with your consistent health screenings, and being and following through with your medications as best as you can. And we wouldn't be psychologists in training / psychologists without emphasizing the importance of tending to your emotional needs as well. And to do that, we have a list of resources here that will be shared with those who were able to register to today's presentation. But we have a list of resources here that span from trying to identify a psychologist or another mental health provider, and also practicing some of the skills we worked on today, such as PMR and diaphragmatic breathing. We also have links to local organizations and support groups. And with that, we are very happy to answer any questions that you may have. Thank you so much for listening.
Thank you.
Thank you both. Really appreciate the practice and the information today. And we already have some great questions coming in, and now is the time. If you haven't thrown yours in the chat, go ahead. The first question, I think, is one I hear from many patients is, should we avoid calling our doctor or nurse when we find ourselves in this cycle? When is it helpful, and when is it maybe not as helpful?
Yeah, no, great question, by the way. And, Akene, feel free to jump in and kind of share your own thoughts and input as well. So I'm assuming, I don't know if this is where the question has come from. I know in the CBT model, can we go back to slide 6 real quick, Akene? We
Yes.
talk about some examples here, right? And I think one of the examples under behaviors was calling your doctor or your nurse. And I'm assuming you're wondering if maybe that's an unhealthy thing or an unhelpful thing for you to do. And I think generally speaking, no, it's not unhelpful for you to reach out to your medical providers just to keep them in the loop about what's going on with your health and your care and to get some clarification if need be or recommendations. I always encourage patients to do that. I think that's actually pretty appropriate and helpful. Now, when you want to be careful is if you notice yourself consistently, like constantly or excessively seeking reassurance, right? If you find yourself calling the clinic like 5 times a day, asking about the same thing over and over again, that might be an indication, right, that you're having some pretty significant levels of anxiety that you might need to address. So if it ends up becoming excessive in any way, that might be a good cue for you to seek out some additional support. But that in and of itself, just reaching out to your providers, absolutely not, is not an unhelpful thing. I think I probably should have clarified, at least for the slide, excessively calling your doctor or nurse is probably something you see when you're struggling with anxiety. But this is really just to kind of show you how your thoughts can affect your behaviors. And that's really what I wanted to point out with this slide is you could have a thought about the cancer coming back and that affects your behaviors, right? You might choose to call your doctor or nurse. And like we talked about, that isn't necessarily unhealthy per se. It's actually smart to do that and keep them in the loop. But just be careful of excessive, just kind of going overboard with certain things. That might be indicative of um, anxiety, underlying anxiety that you need to be treated for.
I also just wanted to briefly add the reason we're emphasizing why you want to stray away from it becoming excessive is because if you spend multiple times in your day calling your providers or trying to seek reassurance, that takes you away from doing other things in your day to day that you need to tend to. But normal checking in with your providers, asking them questions, wanting to clarify things, that is something we encourage you all to do.
Great question.
Yeah.
And I think this question, it kind of follows up to that. It can take a while to get into counseling services, whether that's internally within the cancer center or externally in the community. What can patients do in that very anxiety-inducing wait time to support themselves?
Great question. I'll start off and then Dr. Novell, please feel free to add. So, especially with those who newly get diagnosed, again, we want to emphasize it is very normal and common to feel that wave of anxiety. When it gets to that point where it's very difficult to handle and you're finding yourself on the wait list and you can't get in, hopefully we'll share some of the resources with you all that you'll be able to look through, but there should be other ways to cope with anxiety that we addressed, either if you want to practice those exercises to help in that in the moment anxiety, talking to a trusted person, and I'll speak on behalf of the UT Southwestern Psycho-Oncology Clinic. This may not apply to elsewhere if you're logging in from somewhere else. However, with our Psycho-Oncology Clinic, to help shorten our wait list, we provide additional psychotherapy support groups. So while this isn't individual one-on-one therapy, you will learn skills just as you would in individual therapy. And this is our way to get and spread out as much of the psychological support as we can to more than one person at a time. Dr. Novell, I don't know if you had anything else to add.
Yeah, so again, brought up a great point. We do also offer groups as well. So in addition to the support groups that our support services offers, right, we offer CBT group, right? So this is a place for you to learn some CBT skills to learn to better manage your anxiety or your fear of cancer recurrence. We do also have another group. It's called Meaning-Centered Psychotherapy. And that is, we do have a more specific criteria for patients that would be more appropriate for that group, generally for patients that are more end of life, dealing with like stage 4 cancers. But the CBT group might be a great fit really for anyone who's dealing with the fear of cancer recurrence. And in addition to that, I would actually also point you to our support classes that are offered here at UT. If you go to this link that you see here, join a support group, if you click on that, it will take you to our support groups and classes website. You'll see a list of lots of different cool activities out there that are open to patients and caregivers, including creative writing courses, yoga meditation. I think there's an art one as well. There's so many cool resources out there, and I think all of those could be really helpful for you in the interim while you're waiting on accessing individual therapy.
Awesome. And the next question is one, again, I also hear a lot from patients, is how do we best determine if a patient is more appropriate for psycho-oncology and counseling or psychiatric referral to our psychiatry department?
Okay. Yeah, so great question. I'm not sure how the question was intended to be phrased, but I'll kind of answer it two different ways. So if you're asking about the difference between psychology versus psychiatry, so here in our clinic, psycho-oncology clinic, we don't prescribe medications. We're not prescribing providers, but we do provide therapy, psychotherapy services. So if you're wanting medication management for anxiety or depression, we would recommend that you get a referral from one of your medical team providers to psychiatry. There you'd be able to meet with a psychiatrist who can prescribe you medications to manage your symptoms. Our services, like I said, are more individual or group psychotherapy. So this is talk therapy to help you learn how to better manage your symptoms or your concerns around the cancer. Now, I'm not sure if this is the other way to interpret the question, but if you're asking, okay, do I pursue psycho-oncology versus general psychology services? That's a great question. I think a good way to determine that would be to set up a consult with our clinic, really. That's part of why we do these consults, is to make sure that you're in the right place for what you need. Right? So we will meet with you for a 30-minute consult where we gather some basic information from you about what you need from treatment, and we'll help you figure out, okay, is our clinic the right fit for you? Are your mental health concerns tied to the cancer, to the treatment, and that's why you're feeling anxious now? Or is this completely unrelated to the cancer? And if so, we can provide you with appropriate resources and get you referred out. So to answer that question, I would say setting up a consult with us would probably be a good way to kind of determine if you need psycho-oncology services or just general psychology services from another provider.
So I think this could be an extension of that question, is when might an anti-anxiety medication like Xanax be appropriate?
Good question. I will say I'm not a medication expert, so I can't really provide advice on medications. But many patients choose to do a combination of medications and therapy. And we know from research that a combination of the two can be very helpful in bringing about symptom reduction. So if you're noticing that your symptoms are making it so hard for you to focus or sit down and have a conversation with someone, right? Or it's really interfering with your day-to-day functioning, you can absolutely choose to consider getting medications for it. Now, that is completely up to you as the patient. It's your decision whether or not you want to pursue that or not. But it's an option for sure as a way of controlling your symptoms. Now, it may not help you get to the root of the issue, right? Like what's actually happening, that's something for you to work with your psychologist on. But the anxiety medications could possibly help control some of your symptoms. And once again, if you get evaluated by a mental health professional, whether that's a psychologist or a psychiatrist, they may also provide you with a recommendation. I think you need to I think you need to be on medications. So that might also be one avenue to determine if you need medications or not.
Wonderful, thank you. Great question here about when we schedule worry. What time of day should we schedule our worry sessions?
Very great question. So In the literature, at least from what I've seen, is there's less emphasis on time. If you don't have your day-to-day things going on, you know yourself best. The emphasis was more on the length of time. They mentioned you don't want it to be over a certain amount of time because then it defeats the purpose of scheduling the worry. But if you know yourself and you know you have a lot of work in your morning and a lot of things to do, and scheduling your worry during that time wouldn't be as helpful for you, then you can do it a little bit later. I'll ask Dr. Novell, do you have anything to add on what you've seen?
Yeah, no, I don't think there's a particular time of the day, or anything like that that you need to schedule it for. I think it really just depends on when you're able to just set aside like 10, 15 minutes in order to just practice worrying. So for some people that may be at the beginning of the day before they go ahead and, go to work or take care of their responsibilities. Or for some people, it might be at the end of the day because that's when they notice that they worry the most, right? So if you are someone who worries a lot at night, I might schedule some worry time, maybe sometime before bed, right? Maybe not too close to bed, but sometime in the evening, right? So I would see like, okay, what are your patterns with anxiety and worrying, right? When do you typically tend to worry the most? And is there a way for you to plan worry time maybe a little bit before that so that the worry doesn't start interfering with sleep or work or other responsibilities?
This is a question about when our supportive network doesn't understand fear of recurrence the same way maybe a patient does as a lived experience. So when a family member doesn't understand the fear and they dismiss it, maybe minimize it, how do we explain or ignore that to our family members? And could this be a place where a support group might be helpful?
Yeah, great question. So I will say that one option is really, I mean, if you are already getting individual therapy, is for you and your family member to meet with your psychologist or your therapist. So we can definitely loop the family member into the treatment, and that's of course only with your written permission if you want to include them in the treatment process. But you can always have a conversation with your therapist or your psychologist about what this anxiety is like, for the patient and help them understand how this is affecting their day-to-day functioning, right? If that is something that you're open to doing and you're open to including your family in the treatment process, you can absolutely meet with your mental health provider and have that discussion so that they can have a better understanding of, how significant this is or how impairing this is. I do think support groups could be another avenue, absolutely, for caregivers to get a better understanding. And maybe it'll help, seeing other patients also kind of express similar concerns. Maybe that'll help them understand, how common of an experience this is. And it's completely valid too. So absolutely, support groups, getting in touch with your mental health provider and having a discussion with them, I would say like are, two recommended ideas.
Okay, and this may be our last question. We might get to squeeze one more in. This question, a patient wrote that they're now 2 years into treatment and finding that it may not be as much anxiety showing up as a feeling of hopelessness. Can you talk about where hopelessness might fit in those automatic thoughts and what is most helpful for that?
Great question. I love these questions. Okay. So if we go back to the CBT model here for a second, right? So hopelessness is a feeling, right? It's an emotion, right? Now that emotion is likely tied to some thoughts that you're having about your cancer, about your day-to-day life, right? And it could be impacting your day-to-day functioning in some way, right? Possibly, I'm not saying it is, but maybe it's affecting your behaviors, right? Maybe you've withdrawn from some social activities because you feel hopeless. Maybe you're not engaging in any of your hobbies anymore, right? So the hopelessness is a feeling which I'm guessing is connected to, some related thoughts that you're having about a situation in your life. And I think that would be something for you to definitely explore with your mental health provider. Your provider can help you work through those thoughts, identify thoughts that are unhelpful, right? Like what thoughts are associated with the hopelessness? Are they helping you? Are they not helping you? And then help you slowly reframe those thoughts to be more realistic, more balanced, and also really to instill hope, in you moving forward. And CBT is one of many approaches that we take, but it tends to be the gold standard for a lot of different conditions out there. But there are a lot of other therapies out there that can be used and can also help with feelings of hopelessness. But it could
Also,
be a symptom of something else. You definitely just have to speak to a mental health provider about it.
I also wanted to briefly add, in addition to maybe learning some skills to address some of those thoughts feeding into hopelessness, one intervention involved in CBT is called behavioral activation. And your provider can share more details about this. Your psychology provider can help provide more details. But it is essentially a way to help people increase activity in their day to day, because one common symptom of hopelessness or depression is withdrawing from your day-to-day activities. And so you'll get more guidance with that. As the research shows, changing our behaviors can also correspond to improving and hopefully helping our mood.
Yeah, great point by Kenny. So the feelings and the behaviors are connected, right? So even if you're feeling hopeless, if you can modify your behaviors to be more healthy, then what we know is that that's also going to have a positive impact on your emotional state of mind. So that could alleviate some of the hopelessness that you're feeling.
All right, and I'm going to try to squeeze this last one in. When we don't have access to physical activity, what other options may be helpful to help break this cycle that we can get into with fear of recurrence?
Great question. I would say if physical activity is limited, or maybe that isn't an option for you, then the good thing about CBT is that we can target it from other avenues, right? So if physical activity would be a behavioral change that we would be making, right? Increasing your activity levels, helping you go out, right? So that would be a behavior. Now, if we can't do that, then you can work with your therapist to target your unhelpful thoughts, about your situation, right? Now, I will say, changing your thinking and the way that you're interpreting situations does take some time. But I think if you stick with the process, you can slowly reframe your thoughts so that it isn't feeding into feelings of anxiety or feelings of depression. It can also be taught, you can also manage your body sensations through some of the relaxation techniques. So that's another avenue that you can use, right? So if we're not targeting behaviors, we can still target thoughts and body sensations, and that can improve your emotional state of mind.
Thank you so much. We are right on our 1 o'clock hour. So I'm going to wrap up and answer. One of the questions was if telehealth is available for counseling services, which it is. So please know that if that's the route that would be most helpful and accessible to you. And then many questions about providing the links. Again, this whole recording, a handout will come to you by email next week. So you will have access to all the fantastic information that was provided here. Thank you so much for your time today. Thank you, participants, for being here with us for this hour. And we hope you will join us in July for another Lunch and Learn session.
Thank you, everyone.
Thank you.